Today being Health Tuesday, we will be looking at health matters, and our topic of discussion today is on cervical cancer. Now, cervical cancer is the second most leading common cancer in women after breast cancer, and it is also the fourth leading cause of death among women in this country. And January being a cervical cancer awareness month, it is only right for us to get into this discussion and get to talk about cervical cancer and get to know more about it, get to know about the causes, some of the symptoms, the treatment, and how you can get to prevent yourself from getting cervical cancer. And joining me for this particular conversation is Dr.Elly Odongo. Dr.Elly Odongo is a gynecological oncologist, and just to also give hope to the person who might be having this particular condition, we have a cervical cancer survivor with us in studio, and her name is Pamela Savai. Welcome to the show, Dr. Elly and Miss Pamela. It's good to have you on set.
Thank you very much for having us here.
If I may begin with you, Doc, just to give us an overview of what cervical cancer is.
Thank you for having me in the show. First, we have to understand what we are talking about. What is the cervix? The cervix is the lowermost portion of the uterus. The uterus has two kind of segments. We have got the body and the cervix. The cervix just means the neck. So many times when you see cervix can mean the neck, but in this discussion we'll be focusing on the uterine cervix. It's the lowermost portion of the uterus, and it's what you see when you do an examination of the genital tract and you use what we call a speculum exam to try and part the walls, and you're going to see what faces you, what you come across is the cervix. So cervical cancer, as we have indicated, is now a leading cause of mortality. Mortality means leading cause of death. In that we have got in this country, just to break it down, over close to 6,000 new diagnoses every year, and half of that, around 3,000 deaths arising from cervical cancer. It is affects women across all reproductive age, but we are already seeing that it is affecting them, mainly young women in their most productive period in life. So it's something that we need to